So, okay, now that you've kind of given basically the landscape of what we can do, can you talk about the difference between supporting a school that does maybe have that school nurse that needs that additional support to review bites or rashes or whatever it may be, versus if it's just, and shouldn't say just, but if it's a superintendent or the admin, someone who doesn't have any clinical background, but other than the first aid experience, how does that look like, or what does that differentiate between how we support them at Avell?
Yeah, so what we call that is primary care nursing. And really what that is health program support. And so it's still school nursing, just delivered in a virtual manner. And so we do immunization review, we write the care plans, we get the doctor's orders, we train staff, we make plans for our kids. If our student with epilepsy has a seizure, what are we going to do?
Yeah.
You know, we make the plan, we train the staff so that there is a wraparound service that comes to help and keep those kids in school. The other thing that we do is we provide liability support for the school.
Yeah.
You know, we had a student who there was an accident at school. The insurance company came back. They didn't want to pay, but the documentation showed the school did exactly what they needed to do.
Yeah.
And so it was a support to help the administrators with liability issues as well.
Yeah, absolutely.
Yeah.
Well, and that kind of leads into, I don't know if it's a misconception, but when you're speaking to these superintendents or administrators, how do you explain to them the importance of having good school health available for the students there? Well, what would be your words of advice for that, or how you would really go about discussing the importance of that?
I think when we first started, a lot of our schools didn't know what a school nurse really did. And then I was trying to convince them what a school nurse did, how could it benefit them, and that I could do it virtually.
Yeah.
You know, or we as a program could do it virtually.
Yes, absolutely.
And so I think it's painting the picture. And really who helps to do that is other administrators. And so we had a school in North Dakota who was able to decrease their chronic absenteeism. We started with 2 of their elementary schools and grew to taking care of all their elementary schools because we decreased their chronic absenteeism by double digits, which is unheard of.
Yes.
And the funny thing is we didn't see all those kids that stayed in school, but they made a rule that before you could go home, you had to see the nurse. So some of the students were like, well, I guess I'll just go back to class.
They don't just get to go home anymore.
That's right.
Yes.
There was, like we talked about earlier, you know, the
Yes.
secretary would just let them go home.
Yep.
But now that they have a nurse that needs to assess them, sometimes we talk them through it, you know, like, and we figure out, is it, you know, maybe it's an anxiety issue. Maybe they need to see the counselor. They present as a stomach ache, but maybe there's other things going on.
Yes.
So like in my earlier example, it was related to a medical issue, but sometimes it's not. Sometimes it's sleuthing it out, and sometimes it's really more a mental health issue.
Absolutely. Absolutely. So Sheila, you talked a little bit about the liability that some of the schools could see. Could you also focus on what are the risks that the schools could be carrying out without realizing it, without having the proper school health there for their schools and their students?
Yeah, I think part of that sometimes is that, especially if you're in a small school district and you're trying to figure out how are you going to make that money stretch, and you're like, you don't have a kid with chronic issues like type 1 diabetes, and you're like, well, we could probably fudge on the healthcare. But what happens is there is a basic safety issue that a nurse brings to the students. And so let me give you an example.
Yeah,
we had
absolutely.
a small school in Montana, actually, and a primary kid was stung by a bee. No big deal, went to the office, got first aid, went back to class. So they were a first or second grader. But teacher brought him back down in about 10 minutes because they were just getting so lethargic. So the secretary pushed the button. The nurse came up and got the history and said, I need to listen to the lungs. So they listened to the lungs of the student, and there was not air moving. And so they were having a life-threatening allergic reaction to this bee sting that they've never been stung before. Now, we had put a program into this school that was called the Epi for Schools program. That is for just this reason. If there is a life-threatening allergy that comes up that no one's aware of, there's epinephrine, which is a treatment for that. And so the nurse said, we're just going to need to get the epinephrine. I need you to call 911. And the secretary, rightfully so, was like, can we just wait till the parents get here? It'll be 20 minutes. Well, we couldn't. It was a life.
We don't have 20 minutes.
We don't have 20 minutes.
Yeah.
The nurse says, you've been trained. I'll talk you through it. We'll be good. So they gave the epinephrine. Ambulance got out of its way. It took about 20 minutes to get there. Parent met the kid at the hospital. Truly, a life was saved. But you wouldn't, as an administrator, think about that. You know, you wouldn't think about that because there was very few meds that needed to be given. There wasn't really any chronic health care issues. And yet, that can change in an instant.
Absolutely.
And, you know, with some businesses, you know, you can have 95% success rate, 98% success rate, and you're good. But in a school setting, it needs to be 100%. Because one child loss is too much. I mean, that's the whole world of a family.
Yes.
Let alone the school. I mean, you can go on and on with the losses. And so sometimes I think when these administrators are having to make those hard decisions, it seems like the nurse maybe is the one to cut.
Yeah.
But it is a hard and a risky cut.
Oh, 100%. Well, I just remember when I was getting diagnosed with like all of my GI issues, I'd go to the nurse every single day and they were like, what is your deal? Or do you not like being here? And I'm like, no, something's wrong. But I just think if I wouldn't have had the opportunity to talk to someone else other than my parents thinking it was, an anxiety of going to a class. And I'm like, no, every time I eat, I don't feel good. Well, come to find out it's all these allergies. So, you know, it's just having that support system to talk through that. And I can't imagine my kids now going to school and not having that support. You already have a tough time sending them to someone else. And it just helps kind of have another level of support and comfort for a parent sending them to school.